Can you see?
Yes, sir.
Yes. My feet journey was horrible because the road condition is very pathetic. We left in early in the morning at 5:30 or 6 o'clock. I reached my hospital at 9 o'clock. I left there by Indian time 3 o'clock. By 6 o'clock I am Guwahati and I'm at duty. Just I took my
Nice.
bath,
Alhamdulillah.
had my breakfast and I am now at duty.
Alhamdulillah, sir. We're grateful. Alhamdulillah.
Oh, Ong is there today. Ong, how are you?
Good, sir.
Ong? Oh, your
Yes,
voice
sir.
is like a. Don't call me sir. It's like a brother's voice. Very beautiful voice. Dr. Ong has a very beautiful voice. See, the question is that we as professors, we don't, we are fed up of hearing sir, sir, sir. We are all colleagues in this world. You know, the best part of the judges which I have learned in High Court and Supreme Court, they call each other brother. So we are all brothers and sisters. Yes. I don't know why. Yes, we maintain the word sir because the question is what? It maintains some gap. Otherwise, live a happy life. Be it good. Anyway, let us come to some points, okay? Let me take a comfortable position. Yalla. Harman, write down.
Yes.
Ong, you have a pen, paper? Ong?
Yes, sir.
And paper? Write down these notes. These are very nice. It is my life experience. I have treated large number of patients with nerve blocks. These. Because I used to do multiple treatments, no? So that is why I am famous for that. So before 11, 12 years, we used to practice a lot of tongue acupuncture, 12, 13 years. Then I gave it up because I found it is much outdated now. But for you, it is a new experience. For all of you, you should practice and you will get some instant results. But these instant results or permanent results are not matter. See, once you have reduced the pain, you have to work with the pathology of the disease. So once you see that the cough has come down, the whoopingness has come down, now work with the part of the disease, right? So write down. 22.01, dua dua satu, dua dua dua. (22.01) dua dua satu, dua dua dua. Right? Am I correct?
Yes, you're correct.
Yes.
Yeah. And then select the points from the knee to ankle on the spleen channel, tender points. Arman, open your cam.
Yes.
Oh, sorry, open your mic. Open your mic. Yes.
Yes.
So 22.01, 22.02.
Yeah.
And the tender points in between the knee and the ankle in the spleen channel.
Okay.
So palpitate the spleen channel and you will find many tender points, right? So insert the needle in each tender point and what?
Spin channel.
Yeah, stimulate it with your hands. The
For
treatment
what?
is very good for bronchitis.
Bronchitis. Okay.
Yeah. But if the whoopingness is very high, then go for nebulization and chest PT. Then go for nebulization. Nebulization can be by two drugs. One is orbitamol and one is duolin.
Sorry, what drugs?
Yeah. Sorbitamol is a famous for asthmatic attack. People don't need the suffering from asthma or bronchitis. They keep always this what you call this one
Sorbitol?
sorbitamol. This one you can see. This one inhalers.
Inhalers.
But then what we do, whenever there is a very much choking, we give it with nebulization.
Nebulization.
Nebulization is you have to nebulize the patient after every 2 hours. Then you may have to give some corticosteroids if the condition is bad.
Okay. Corticosteroid.
If the condition is bad.
It's bad. Okay.
Then write down 22.01, 22.02, 221, 222.
Okay. 221, 222.
With SI 22.01, 22.02 with SI3
Huh?
with
What?
SI3
Small intestine, SE.
SI3
Oh, small intestine.
SI
SI3.
SI
Okay.
SI3 small intestine 3 SI3 kidney 3
Okay. Kidney 3.
yes and and BL40 and SP9
BL49
BL40
or BL40 SP9.
हाँ
Eh?
then write dua satu dua 22.01 22.02 PC6 heart 7 liver 3
PC6 heart 7 liver 3.
yes very good for knee pain
Very good for
yeah classification osteoarthritis
osteoarthritis.
osteoarthritis
Sir, just now 20.1, 0.01, 20.02, SI3, kidney 3, BL40, and SP9 for what?
For palpitation.
Okay, thank you.
Guru, just a clarification.
Tell me.
The 2201, is it lung 10?
Generally, you are right. It is called lung 10. But then, when we speak about these points, tongue points, many of the points, TCM points, are overlapping points. But then the way of treating these points and taking this point is totally different. So we don't mix it.
Thank you.
Then comes right, dua dua satu, dua 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 is 22.01, 22.02.
Yes.
Dua dua satu, dua 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 with PC6 heart 7.
Okay, PC6 heart 7.
Heart 8.
For headache.
Yes.
Okay.
Dua satu, dua dua dua. For what I am seeing this point?
Headache.
Huh?
Headache.
For what?
20.
Headache.
Sakit
Yeah.
kepala.
Headache. Yeah. Sakit kepala, right? Or kepala nyeri.
Yes, yes.
Kepalik nyeri.
Ya, benar-benar.
What do you call gallbladder in Bhasa?
Sakit kepala or nyeri kepala.
No, gallbladder, what do you call?
Oh, gallbladder, kandung kemih.
Betul,
Hah?
betul.
No.
Betul, kandung kemih. Iya, betul. Gallbladder. Oh, gallbladder. Kandung empedu, kandung empedu.
Kandung empedu.
Kadang apadung, right?
Kandung empedu.
Kandung
Empedu.
empadung. Ampadung. Yes. Kandung ampadung. Yes. Kandung ampadung. So gallbladder 31, 32. For migraine, you can write 221, 222. Gallbladder 31, 32 means GB31, GB32. Gallbladder 31, gallbladder 32 with 22.01, 22.03 with liver 3, PC6 heart 7.
Okay.
It gives immediate relief in most of the type of headaches.
Migraine.
And most of the type of headache.
Okay.
Sir, can you repeat one more time? Thank you.
Yes. 22.01, 22.02. 221, 222. Arman, open your mic.
Okay, yes. 221, 222, PC6, heart 7, gallbladder 31, gallbladder 32, liver 3.
Yes. Arman, you can again open it.
Okay.
Gallbladder 31, gallbladder 32, liver 3, PC6, heart 7. Very effective for all types of headache. Over?
Over.
So if you have a fever, then what will you do? Right. Dua dua satu, dua dua dua. 22.01, 22.02.
Yes.
Tiga bolo now. For what?
Ah,
What was the
36.
point I was? For what? GB35, what for I said?
Huh?
Yeah, GB34. Tiga polo path.
Okay.
GB34.
Yes.
Stomach
This one?
36. Stomach tiga polo now.
Okay.
Stomach 36. Gallbladder 34. Spleen 9.
B9, B9.
Spleen 6. Liver 3.
Okay.
And put needle in all the jingle points of hand.
At?
All the jingle points of the hands.
This is for what, sir?
Treatment for
Fever.
Huh?
Liver.
Fever.
Fever.
Thank you, sir.
Sir, liver or fever?
Fever.
Fever.
Jingle point.
Guru, Jingwa point on one hand or both hands?
Both hands.
Okay.
Thank you.
Jingle.
Yeah, when the situation is slightly serious. Over?
Over.
Right, 22.01, 22.02, 20.2.03.
Okay. 0.03.
Right. 221, 222, 223. 22.01, 22.02, 23.03 is also good for conjunctivitis.
What? Conjunctivitis.
Yes.
Okay.
22.01, 22.02, 22.03. plus
843.
kidney 3,
Oh my god, what's voice?
kidney 3, with kidney 3, BL40, SP9, SP6.
BL43.
221, 222, ya 221, 222, 223. Right, 22.01, 22.02, 22.03.
Yes.
With kidney 3, BL40, SP9, SP6.
BL40 40.
4.
40.
40.
Ya.
For sciatica pain, right? Then right again when I said na conjunctivitis, right? One more point is 221, 222, 223 is 22.01, 22.02, 22.03 along with
Kidney 1, kidney 3, BL40.
no. And this is for sciatica. Now write for conjunctivitis.
Oh, that one just now sciatica.
Yes.
Okay.
Now write conjunctivitis. Dua satu, dua tiga. Plus.
Okay.
887 blast. 888 blast. 889 blast.
8817, 8818, 8819.
Yes, 888 blast, 889 blast. It means 88.17, 88.18, 88.19.
Okay.
Then 7 blast. 11.17.
Okay. 11.17.
Yes. It will give you a lot of relief in the eye. What are the points? Again, I repeat. 221, 222, 223 means 22.01, 22.02, 22.03. Right? 221, 222, 223.
Yes.
Correct?
Correct.
Plus
8817.
8817, 1 minute, let me say. 8817, 8818, 89. Means 88.18, 17, 88.18, 88.19.
Yes, correct.
Plus 1117.
Yeah.
So 11.17.
Yes. 100.
So this is very good for. This is very good for conjunctivitis.
It is. Mata merah.
For cold, for nose, right? Very frequently catching cold, allergic.
Oh, allergy.
Yes.
Cold.
Cold allergic.
Okay.
Cold, dingin.
Dingin. Alergi dingin.
Dua satu, dua tiga. Means 22.01, 22.02, 22.03. Lang 6, lang 6, lang 9.
Oh. Yeah.
Herman, open your
Okay.
mic. I am saying you to open your mic, not your belt, okay? Don't confuse it.
Okay.
What are the points?
For cold allergy.
1 minute. Let me repeat. For cold is 22.01, 22.02, 22.03. Dua satu, dua tiga. Correct? With lang 6, lang 9 means lang 6, lang 9.
Yes, correct. Lang 6 and lang 9.
With liver 3.
Okay.
Right?
Right.
It is good for what?
Cold allergy.
Cold allergy.
Along with LU1, LU10.
Oh,
Not not LU10. It is called. Yeah, it's okay. It is right. 22.02 is LU10 only. Okay. LU9, LU6, correct. With LU11.
Okay, LU11. Oh my God. Also pin.
What are the points? I'll repeat.
Okay.
Dua satu, dua tiga, 22.01, 22.02, 22.03. Correct?
Yes. Correct.
Along with LU6, LU9.
Yeah.
Correct?
Correct.
With LU11.
Yes. And liver 3.
And liver 3.
Yeah.
So it is called Lingo Dabai combination. It is very good combination. You will learn a lot of things from this combination.
Okay. Lingo.
So we call it Lingo, LINGO Lingo, and 22.04 is called
Dabai.
Dabai. So 22.04, 22.05. So write down for cervical spondylitis. Lot of combination will come now.
Cervical
Spondylitis.
spondylitis.
Right. PIVD. C5, C6 acute pain. Aman, okay?
Okay.
Where is Melody today? I did not see Melody. Where is Melody? Hey. C47, where is your wife? Where is Melody? What is, oh, husband of Melody? Where is Melody? Not in the class? Open your mic.
Yes. Cervical spondylitis.
One minute, huh?
Okay.
Poor connection here, sir. Very low signal.
Very low signal. Did not hear you. That's why the signal is not good.
Arvind, where is your friend? Arvind? Malaysia. Arvind?
Hi, sir. Hi, sir.
Where is your
Hello?
friend? Where is your friend, that person?
Ong Liang, is it? I think he's too busy. He cannot join the class.
Ah.
I already asked him for 2 times already. He was not here
No
for
need
2
to ask him. No. Don't ask him anymore. We are not
Oh,
supposed to request anyone.
okay. I'm sorry.
It's okay. We are not supposed to request people to join us and learn us. People have to learn for themselves, not for us.
Yeah.
The knowledge is for your own self to recover your patients, not for me or for anyone. Anyway, write down. I actually like Indonesian Bhasa. I'm very sorry to Nigerians and Indians and other people. But I like Indonesian Bhasa. Without Bhasa, I cannot teach Tung Acupuncture. I'm very sorry. If you take away Bhasa from me, I cannot teach Tung anymore in my life. Because this is outdated knowledge for me. I'm a practitioner. So only this Bhasa is the language which motivates me to teach Tung Acupuncture. So long you allow me to teach in Bhasa, I have no problem. The moment you take away Bhasa from me, what I will do? I cannot teach Tung Acupuncture in my life. Right now. Anyway. Right on. Arvind? Arvind?
So you
Arvind,
talking
open
to
your mic.
who you calling, sir?
Yeah, yes, you only to you. Write down.
Okay.
Yeah, I'm calling you. Write down. It's very important. This combination, you repeat after me, okay? These are very traumatized. These are very good combinations of my life.
All right. Let's go.
Only to teach this combination, Robert Cho charges how much in dollars, you know? He charges around $500 or $400 only for this class, which I am teaching you for free. Only these combinations. We'll give you 36 combinations. For teaching you this 36 combination, how much will he charge, you know? $400. So write down these combinations, right? You know Malaysian Bhasa, na?
Yeah.
So right. Dua dua pa, dua dua nam. That is 22.04, 22.05. With tujo 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 nam. Tuja polo nam means 27.26. 77.26 is a 3-point location near the Achilles tendon in the bladder channel. So what will you write? Dua dua pa, dua dua nam. That means 22.04, 22.05. Arvind, open your mic.
So you said 20. Nam is 6.
Nam is 5.
Lima is
Oh,
5.
Nima. Oh, sorry. Yes.
Yeah.
22.04,
Okay.
22.05. Sorry.
Okay. I was alert.
Thank you so much. Still, I made some mistakes in Nam and Nima. Yeah, 22.4, 22.5.
Yes.
Dua dua pa, dua dua nam. With tujuh tujuh.
225.
26. 26. Or lima na? Lima or nam? 26 is nam.
224, 225, 777,
7 nam. Yes, I am correct.
224, 225, 7726.
Correct. 7726. Yeah. 7726 is a 3-point location called as 7 tigers.
This, sir, is there in the bladder section.
Yeah, it is in the bladder channel near the Achilles tendon.
Thank you, sir.
It's a 3-point location. You can see in Google. You can write 2.7 tigers. 2.7 tigers. What did you see the number? 77.26?
726, sir.
3-point tiger close to the Achilles tendon.
Yeah, close to Achilles tendon. And it is 77.26. You see, even after 12 years, this memory is very fine.
Okay, thank you, sir.
So what is the location for cervical spondylitis? Dua dua ampat, dua dua nam, tujuh tujuh, dua puluh enam. So 22.4, 22.5, 77.26 is very good for C5, C6, C6, C7 nerve compression when the pain is in the ulnar nerve. Acute pain in the ulnar nerve.
All right. Do you want me to repeat? Sorry, do you want me to repeat?
Yes, repeat it.
Yes. You repeat in English.
All right, so it's 22.4, 22.04, 22.05, 77.26. It's also known as
Slowly.
Okay, for treatment for cervical
22.04.
spondylitis with the pain of the ulnar nerve, is a decompression pain, is a compression pain until the ulnar nerve. So you hit the point 22.04, 22.05, 77.26, which is also known as a 3-point tiger, which is located near to the Achilles tendon. Thank you.
It is not 3 tigers, it is called 7 tigers. It is the power of the 7 tigers, it is called.
Okay, sorry, 7 tigers.
Right? Now C3, C4, C5.
Yeah, C4, C5, cervical spondylitis.
We call it PIVD.
Prolapse intervertebral disc.
Yeah.
All right. Okay, thank you.
We call prolapse of the intervertebral disc or IVDP. Intervertebral disc prolapse. This prolapse I already taught you. This is a prolapse means the disc comes out and compresses the nerve. So write down. Dua dua ampat, dua dua nam, dua dua lima. Lima. So 22.04, 22.05, 22.06. SI3 8.04. SI3 8.4. Ampat. Ampat. What are the points? 22.4,
Yeah.
22.5, 22.6. C4, C5. PIVD, C4, C5. It's a pain management, right? Not a pain treatment. It's called as a pain management. It is called as what? You insert the needle and the pain is gone. Yeah. Not pain treatment. Write down. Dua dua ampat, dua dua nam, dua dua nima. Along with SI3 8.04. Or PIVD C4, C5, C5, C6. Over?
Sir, again, sir, regarding sa SI3 and C4, C5, it's a kind of pain management.
Yeah, right. Dua dua ampat, dua dua nam, dua dua nima. It was 22.4, 22.5, 22.6. Dua dua ni pat, dua dua nam, dua dua nima. Correct? SI3 means SI3, small intestine 3, 8.04.
Yes, sir.
Am I clear?
Okay, sir.
Yes, sir.
One minute, let me see some more things. Generally, we don't use all these things anymore. Right. When there is a PIVD pain in C5, C6, C5, C6, VAS scale 10 by 10. IVDP, intervertebral disc prolapse or slip disc in C5, C6. Arvind, can you hear me? Arvind, Malaysia. These boys are very dangerous. They come in the class and they run away. Are you there? Arvind, are you there? Maybe connection cut off.
Hello.
You are there. Do not run away.
No, I'm always here. Because my signal is not good, you know.
It's okay, la. Write down. These points are very important. If you don't learn it right now, it will be very difficult for you to work with this type of cases.
Okay.
C5, C6.
Okay.
Dua dua pa, dua dua nam.
Okay.
Please, 6, 5 is 5.
Yeah. 22.4, 22.5, 22.6. 3 points are required. 22.4.
So it's 22.4, 22.5, and 22.6.
Yes. Along with so dua dua pa, dua dua rima, dua dua nam. Beres? Dua dua pat, dua dua ampat, dua dua rima, dua dua nam. 22.04, 22.05, 22.06. Along with GB20. And GB21.
You want me to repeat?
Yes.
Okay, so for C5, C6, intervertebral disc prolapse will be 22.4, 22.5, 22.6, and GB21.
GB21 and GB20. GB dua puluh 21.
Okay.
So again I repeat. Dua dua ampat. No, I will repeat. Let me see if I can do. 22 point. Dua dua ampat, dua dua lima, dua dua enam.
224, 225, 226.
Yes, correct. Along with
GB20, GB21.
22 and 21.
Yes, correct.
GB20, GB21.
And this is for what, sir?
We told you C5, C6. That is why I said you whenever you were in my class. If you don't understand, please clarify yourself right now. But then you people did not hear me carefully. Now you will be confused everywhere because your foundation was not clear. When I was teaching you MRI, I told you this is C5, C6. This is a nerve compression for C5, C6. This C6, C7, C7, T1. This is a combination of C5, C6, C6, C7. How the pain is going in C5, C6, C6, C7. You did not hear me. Now you'll be confused. What can I do? That is why I said always be careful in the class. If your foundation is weak, you can never return anything in your life. This is why I say you in this class, how many are motivated students? Only 10 or 15. You know, when these people write in the Facebook, they are excited, when all these things are there, we understand you want to be motivated, but 80% of the people, what they do, They don't do anything. They come in the class. Neither they will motivate others, nor they will motivate themselves. What will happen? That is why some people, they stay wherever they are after 20 years of their life also. Anyway, what I can do. At PIVD, Arvind, open. My Malaysia.
Yeah, I'm here.
Open. Open your mic only. Okay, nothing to else open.
No, because there will be interruption sound.
It's okay. Whenever there is interruption sound, I'll go to.
Sastraji, Jackson here. Actually, I got married today. It was a very short notice due to COVID. So, I have to inform you and I request your blessings. So, hopefully, we can catch up later. Thank you, sir.
One of my friend got the married today. I just saw his message and I just said, thank you so much. Prayers and blessings. This is how we attend our marriages, you know. In 1 second, my marriage attendance is finished. Congratulations. Thank you so much. Blessed. Prayers. Topic over. Right done. C4, C5, C5. What was the point I said? Which was PIVD? Arvind.
Hello?
Arvind? Which
Hello?
was the location? Which location did I mark out? Which location?
224, 225, 226, GB21, GB20.
For which location? Cervical C4, C5 or C5?
C5, C6.
C6. Vast and bottom.
C5, C6, 24, 225, 226.
Yeah, okay. Now write for C4, C5, C6, C7. C4, C5, C6, C7.
Okay.
Dua dua pa, dua dua rima, dua dua nam.
Same formula.
Yeah, from lingo, this is the best part of tongue acupuncture. If you go to 100 points, comes to 150. With minor here and there, that's it. That is why I say if you practice for only 1 month or 2 months properly, you can master tongue acupuncture like me. I left tongue acupuncture how many years back? 12 years back. I only taught last tongue acupuncture when? In Indonesia. Thereafter, I never taught tongue because it was boring. It has nothing to do with that. It's a pain management, not a pain treatment. But now, since I promised you, I'll teach you pain management. So it's a very good for that. Write down. With GB21, GB20, and tujuh tujuh dua polo. Tujuh tujuh dua enam. 22.04, 22.05, 22.06. along with GB21, GB20, and one more point you can use. LI11 with 77.26. Correct?
Yes.
C6, C7, C71. Dua-dua enam, dua-dua, sorry, dua-dua empat, dua-dua enam, dua-dua.
224, 225, 226.
No, not 5. 224, 225. Okay, 224, 225 means 22.04, 22.05, along with 222, 223 means 22.03, 22. Write down 22.02, 22.03, 22.04, 22.05. Along with 77.26. 7726. 77.26. 7726 or 26. One minute, I'll switch on the fan. I'm feeling very hot. Hello, can you hear me?
Yes, we can hear you, but your screen, please.
Yes, sir.
Yes, sir, we can hear you.
Yes, sir, we can hear you.
Yes, sir. We can hear you.
Now, can you see my screen?
Not yet. Yes, now it's okay.
Right now, C7, C8 junction.
C7 T1 or?
Yeah, C7 T1. C7 C8. This is why when I take my classes, I tell you very sincere. You see? Now what happened? You are so much confused. It is why I say read properly, do your homework properly, study properly. Yes or no?
Where can you repeat the slide of 22.1 because my signal before is not good.
I don't know what you're writing. Ask Arvind to share his notes. Arvind, can you share your notes with these people after you write down properly? Arvind, Malaysia? Hello? Arvind, can you hear me? Harman? Harman?
Yes, yes, I'm here.
Okay, write down.
Okay.
C7, C8.
C7, C8. Yes.
22.4, 22.5, 22.4, yes. No, 22.5, 1 bit. Yeah, 22.4, 22.5, yes. 224, 225. 224, 225, 22.04, 22.05, along with 7726, means 77.26,
Yes.
along with Sanjo 15,
Sanjiao.
15.
Okay. 15.
Rima Blast, right.
Okay.
Right. Sanjo Nima Blast, Path Blast. Gallbladder 21.
GB2.
GB20, GB21.
No. GB20, GB21, SP, SI15, SI14. So Herman, repeat the points.
Okay, for cervical 7 and C8, 22.04, 22.05, 77.26, Sanjiao 15, Sanjiao 14, GB20, GB21.
Correct. Very much perfect. Okay, everyone written?
Yes, I have.
Everyone okay?
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes. Sir, can I ask question?
Yes.
Just now, 22.02, 20.03, 22.04, 22.05, 77.26 is for what?
C4, C5, C6, C7.
Oh, C4, C5, C6, C7. Oh,
PIVD.
but this C4, C5, C6, C7 is 22.04, 22.05, 22.06, GB20, GB21, 7726, LI 11.
So this combination is the second combination is when the disc is herniated, the pain of acute.
Okay.
Yeah. There are many stages. The stages are protrusion, herniation, extrusion. But then even if I say this, what will happen? Panic, because you did not attend my class seriously. What are the three stages of the disc, Harman? What are the three stages of the disc degeneration? What are the three stages of disc degeneration? Yes, tell me what are the three stages of disc degeneration?
Herniation, extrusion, prolapse.
You cannot say like this. You have to say protrusion, bulging, protrusion. Herniation is not the stage actually. But then some people call it, some people may not say. So come protrusion, extrusion, sequestration. See, no one attended my class properly. Neither you made the notes properly, neither you made the revision properly. Today when I am teaching this, totally confused. I don't know.
PVID.
It is called what? PIVD or IVDP. It is called as IVDP. Correct?
Okay, sir.
Three more stages of this degeneration. Write down how many stages that this degenerate. Write down. Bulging, protrusion,
Protrusion.
then write lateral protrusion,
What?
lateral protrusion, lateral.
Okay, lateral protrusion.
Then write paracentral disc protrusion, paracentral,
Protrusion. Paracentral protrusion.
herniation,
Herniation.
extrusion,
Exclusion.
paracentral disc extrusion,
Paracentral disc exclusion.
sequestration,
Sec.
sequestration. SEQ. Write down whatever you like, then you correct it with Google. Sequestration. Then like herniated component, caudal migration.
Component.
Caudal migration of right. Caudal migration. Caudal migration
Migration
of the herniated component.
of caudal migration of the herniated component.
Correct. Right. Now write down for low backache. Dua dua dua, dua dua tiga, dua dua empat, dua dua enam. Lima, dua dua lima. Sorry.
Okay.
Dua dua dua, dua dua tiga, dua dua empat, dua dua lima. Correct? 22.02, 22.03, 22.4, 22.5.
Yes.
SI3.
SI3. Okay.
Insert needle near DU3, DU4.
DU3, DU4, DU.
DU. DU3, DU4. Right. Then
For low back pain.
yes. PIVD L2, L3. PIVD L2, L3.
PIVD L2, L3, L2, L3. Lumbar 2, lumbar 3. Okay. Prolapse interference.
PIVD L4, L5.
New one.
Right.
4.
Dua dua satu.
2, 2, 1.
Dua dua empat. Dua dua lima. 22.01, 22.04, 22.05. Twenty-two point zero one, 22.04, 22.05.
4, 5.
Along with Right. What are the points? Dua dua satu, dua dua pat, empat, dua dua enam. This 22.01, 22. Sorry, lima. Yes, 22.01, 22.04, 22.05. And also you can use Rima. Nam.
Okay.
22.01, 22.04, 22.05, 22.06, along with ladder 31, 32, means ladder 31, 32.
Bladder.
31, 32.
Okay.
PIVD L4, L5, L3, L4.
PIVD L4. PIVD L3, L4.
Enggak mau Kak. Ya, nothing to lose. If you lose, ada jalan. Nice.
Okay.
Okay.
With secondary canal stenosis, 7.5 mm. Acute pain, 10 by 10. SLRT, 30 degree. SLRT, 30 degree. Okay. What did you write?
Which one?
Now what did you write? L4, L5?
Alpha Alpha 22.01.
Write down L4, L5, this extrusion.
Okay, Alpha
First write
Alpha
down what is the indication. Yes. L4, L5, this extrusion.
4, 5.
Disc extruded.
Extrusion.
Secondary canal stenosis. Caudal migration.
Caudal migration.
Caudal migration, yes. SLRT 30 degree. Nerve impeachment.
Nerve
Nerve. Impeachment. Nerve impeachment. Tingling sensation present.
What sensation?
Tingling.
Tingling. Tingling sensation.
Right?
Yeah.
Dua-dua empat, dua-dua enam, dua-dua lima. It is 22.4, dua-dua lima, 22.5, dua-dua enam, 22.6. Along with dua-dua satu is 22.01. Right? Dua-dua empat, dua-dua lima, dua-dua enam. 22.456. Right? Along with
22.01.
Yeah, along with 22.01. And 22.02. Dua-dua-dua. What are the points? (22.01, 22.02), 22.4, 22.5, 22.6. Along with 22.06. Okay. Then use BL 26, 27, 28.
BL 26, 27, 28.
Ya. 26, 27, 29.
8.
No, no, 28, 8, 8, 8, 26, 27, 26, 8.
Yeah. Yes. Correct.
26, 27, 28.
Yep.
Along with 31, 32, 33. UB means BL 31, 32, 33.
Okay.
Stimulate these local points. Taking Lingu Dabai. with the pain, topic over. You will get immediate recovery. Now those who are medical doctors, any medical doctor here? Medical doctors, anyone?
Yes, sir.
May I know speaking?
Uni, sir.
Huh?
Uni, sir.
Uni, yes. Uni. Uni, do you use spinal needle in your clinic?
Not yet.
So no
Spinal needle. You mean for lumbar
anesthesia
puncture
one
like that?
needle. Yeah. What we use for spinal anesthesia. What we give for nerve block. Do you use that needle?
No, I didn't. Usually in my country, the anesthesiologists who usually use that needle.
No, but then you can use it for pain management. If you use only in epidural region, then anesthesia is required. But when you use in paraspinal region, this needle is just a needle. It is not defined that only anesthetist will use it. No country can define it. Any GP can use it for paraspinal purpose. Only for epidural steroid or for spinal anesthesia, you need an anesthetist. It's the same needle, right? So, generally, my brother from what do you call Sovik Kong, he uses it. Sovik, can you speak to me? Sovik Kong?
Yes, sir.
Write down. This is for you.
That's a point I like to use.
I know. You are a genius. So take the location, take spinal, write down the combination. Dextrose 5, 40%. Normal saline, 60%. Use the point BL24. Which point, brother? BL20?
24.
Yes, BL24. How much you will insert the spinal needle number 23? Spinal needle 23. Yes. Point number 24. Dua bolo path. Dua ampat. Insertion depth 1.5 centimeters. BL24. Spinal needle. Depth 1.5 centimeters. Normal saline 60%.
60%.
And
Dextrose 40%.
Dextrose 5,
yes.
40%.
Dextrose 5, not dextrose 25. Dextrose 5, correct.
5.
How much ml you have to put? $10 ml. So, Vic, am I clear? So Souvik?
Yes, it's clear, sir.
Can you repeat what did I say? I think you forgot what I said. Again, I repeat, brother. See, spinal needle, which number?
23.
24.
23.
23.
23.
Yes. Yes. You know why it is important? You know, today also I told you about a case in the morning time. Generally, when the steroids are given in the epidural area, it goes along with the CSF inside the brain, right? What will happen then? What will happen? If you insert the saline epidural steroid in the CSF, what will happen? Patient will immediately go to coma. That is why we found out this solution in which you don't need to give any epidural steroid. It's a safe, but only medical doctors are advised to do it. Souvik, my brother, is a medical doctor. Am I right, Souvik?
Yeah,
Souvik?
sir.
You're a medical doctor? Are you a medical doctor or acupuncturist?
Yes, I'm a doctor. Yes.
This is what I'm saying. So she can use it. But those who are non-medicos, I don't know what you will do. So, since some medical doctors are also here, I can give them some special advice. So, brother, which are the point you will use? You will use initially with the spinal needle 23, insert 1.5 centimeter parallel, perpendicular like this. So, can you see me?
Yeah, yes.
This is BL20, what you call 24. Take spinal needle like this in BL24 and go deep. Up to how much? 1.5 centimeters. Correct? Then which is the combination of point you will use? A solution. Dextrose 5, 40%. Normal saline.
60%.
60%.
60%. Very correct, Dr. Lee. Very correct, Dr. Lee. How much ml? 10 ml. Pushing time, how much you will take? 3 minutes. You have to push very slowly. How much pushing time? 3 minutes. 3 to 4 minutes.
4 minutes.
Right. Thereafter, take out the needle, put some betadine there, and put a cotton and then a band-aid. Correct? Then take one 5 ml syringe and our dispo one needle, no? This 23 number. Or 22, which we use for 2 ml injection. Disposable syringe, 2 ml needle, 5 ml injection. D5 60%, NS 40%. Insert in 27, 28, 29, 30, 31, 32, 33. 1 ml each. 27, 28, 29. But then you have to bend the needle. Sovik, see how to use it. Sovik, can you see me, brother? Sovik, can you see me?
Yes, yes, I can see you.
Yeah. So see, first you have to bend the needle. See, this is the needle. Use like this and bend it with the help of the skin. Correct? See. Don't use it like this. Use like this and bend the needle. So it will become like this. Correct? Now insert it in which point? 27, 28, 29. So go to 27 like this. Insert 1 ml. Take out. Go to 22. 20, not 2, sorry, 28. 1 ml. 29, 1 ml. 30, 31, 32, 33. So this will be how many? 5 ml you have to adjust in 6 points. It will start from 27, it will end at 33. Mm-hmm. 27, 28, 29, 30, 31, 32, 33. 7 points. So you have to insert how much? 7 ml. How much? 7 ml. So take a 10 ml syringe. 10 ml syringe combination D5 70%, normal saline 30%. Normal saline how much?
30%.
40%.
30%, madam.
30%.
Okay. 30%.
These are the points you have to put. 27 to 33.
30.
33.
33.
Yeah, 27, 28, 29, 30, 31, 32, 33. 1 ml each. Topic over? Now you will see the hamstrings are tight. So, can you hear me?
Yes, I can hear you, sir.
After this procedure, you will see what? The hamstrings are very tight, right? So what to do? How to remove the tightness? Take. See, so everyone can see me?
Yes, we can see you.
Yes.
Arvind, can you see me? Malaysian
Disappear.
Arvind? Malaysian Arvind, can you see me? Malaysian Arvind, can you see me? It's not there. See, now what to do? Take the leg like this. Pressure on the knee. Correct? So, can you understand? Did you understand? So,
Yeah, yes.
see, you have to take the leg in the SLR position. This is a lower limb on rest, right? This is a lower limb on rest. Correct? Now, take the leg like this. Correct? Up to 70 degree.
Oh, up to 70 degree.
73, no, 70 degree. So it will become like this. Sometimes the pain is very high, even after doing this, because there is a lot of tightness in the piriformis and the hamstring. So what to do? Ask the person to put the leg on your shoulder joint. Yeah, in the trapezius here. Right? Souvik, did you understand me? Ask the person to put the leg on your shoulder.
Shoulder.
Yes. Then ask him to press your shoulder. 1, 2, 3, 4, 5, 6. Right? You pressed it for 6 seconds, right? Then you take 10 degree up. Correct?
10 degree up.
Yeah. Then again ask him to press for 6 seconds. 1, 2, 3, 4, 5, 6, 7. Right? Then take again the leg for 10 degree up. Correct?
Okay.
Now the leg has come to 40 degree. Then again use it for 1, 2, 3, 4, 5, 6, 7. Bring it to 50 degree. You will press the shoulder like this, see?
Step by step into the day.
Like this, yes. We'll press on your shoulder like this, see? This is the ankle, we'll press it like this, correct? So it will press you up to how much second? 7 seconds. Then you lift, then you take 10 degree up. You raise your leg up to 10 degree, right? Then again you will press 7 seconds. Again then you put it for 10 degree. Then 10 seconds you will press. Then again take it for 10 degree. So you have to bring the leg in 80 degree, right?
Sastry. I go to this guy.
Then DNS. Use what? DNS. Dextrose normal saline. 10 ml. Yeah. Now identify the tightness in the hamstring.
I'll go fridge, madam.
What will you find out? Tightness in the
hamstring.
Hamstring. The patient will complain that this is tight, this is tight, this is tight, this is tight, right? Now bend the needle again, like this. This is the needle, bend it like this, okay? Now insert it like this. Wherever there is tightness, insert 2 ml. Touch 2 ml. Touch 2 ml. Topic over. Within 5 minutes, the pain is gone. Hamstring is released. And then insert BL40 3 ml. And SP9, SP6 and SP9 to 2 ml. To 2 ml.
Please repeat BL40 and then
SP9, SP6 to 2 ml each. In this way, you recovered a very critical case who was supposed to be, who was required immediate surgery. This procedure is not less than 1500 to 2000 ringgits.
Sir.
Yeah.
In case you can demonstrate the point that you are injecting, it'll be easier for other people to
How will I
understand.
demonstrate? How will I demonstrate? There's
no patient with you.
No. I mean from the drawing, from the picture. That'll be good, yeah. Because we understand. I think many people they won't understand, yeah.
I don't know how to share also. So yeah, we will do something like that. So
live show lah.
Live show lah. Everything live. Wait a minute. I'll show you something. So this is called spinal needle. Can you see? Can you see? Can you see my screen?
Yes, we can see your screen. Yes.
I can see.
Yeah, this needle is called what? Spinal needle. See, this is the size of the spinal needle, right? So it has a safety cover. So you see, this is the safety cover of the spinal needle. How to open the needle? See, you have to be very careful because spinal needle is one of the reasons for creating infection in the spine. So how you will do? Ask your sister first to sterilize her hand, right? Then the physician has to sterilize the hand, correct? Right on the procedure. First, your assistant, there 2 people are required. How many? 2 to 3 people are required in this procedure. 1 people never should do this procedure. 2 to 3 people required, correct?
Yes, required.
Yes. So what you will do? First of all, you have to remove the clothes of the patient. Remove all the clothes. And then put a bed sheet, sterilized bed sheet on the patient. And then use a cut sheet. You know cut sheet?
Mm-hmm.
It's called the cut sheet. Cut sheet in surgery. This is called the cut sheet, which we use in the surgery. Can you see?
Yes, we can see it.
So what we do, first of all, we remove the clothes because these clothes are the most important reason of infection. Then use betadine first. Then clean it with spirit. Yeah. Clear? Sovik, are you clear?
Yes, yes.
First, remove all the clothes. All underwear and all, remove it. Then put a cloth over it. If it's a male, it's a female, then you have to go give him some gown or take clothes. Then put a cut sheet on the localized area where you are going to insert it. There, before that, you have to clean the entire area with what? Betadine and spirit. Clear? Then put this one, cut sheet. Okay? Then, before it, clean the area with betadine. First use betadine to clean it, then spirit. Correct? So this is what you see. These are the nerve roots. Clear? So, generally epidural blocks are given like this. See, this is the epidural block. You can see. But what we do, we don't take this area. We go through paraspinal area. Because if you make a mistake here, what will happen? You might touch the CSF fluid and the CSF may go inside the brain. And what will happen? Patient may go to coma or he may die. What I gave you today. So this is the location how generally in anesthesists to use it. Here you can see. So can you see this?
Been muted.
Yes,
someone muted my mic. Can you see it?
Yes. 2 fingers.
Yeah. Now insert the spinal needle perpendicular in this location.
L4, L5 itu ya. L4.
How much centimeter? 1.5 centimeter.
2 finger breath.
Yeah, 2 finger, correct. What is the combination of injection you are going to use?
Dextrose normal saline.
Normal saline 60%.
60.
Dextrose 5, 40%.
Dextrose 5, 40%.
Okay.
10 ml.
10 ml.
10 ml on the acute pain, 5 ml on the other side. Because the pain is generally in one side. So whichever is acute, give that 10 ml, and on the opposite side, same point, how much ml? 5 ml.
Okay, 5. They cannot carry.
Okay, so we clear?
Yes, yes. Just now, Dr. Sastry, you mentioned
Yes,
about
sir.
injection over the hamstring muscle. So you are
That
injecting
part also I'm going
over
to.
the middle point,
One minute.
the middle line of the hamstring.
1 minute. Let me just complete this part also.
Okay.
Because the topic, only one part is finished right now, okay? The paraspinal area is finished, correct?
Yes, yes.
Now you have to go to the nerve roots. Yes, Avik. Oh, 1 minute, I have to take the bigger picture. So, Avik, can you see the picture?
Yes, yes, it's clear.
So now what are the points you are going to use? See, BL27,
7 until 33.
28. If the pain is very acute, then use 53, 29, 29 is very, very important. 31, 32, 33, 34. And if the pain is in L5S1 also, then use 35. What are the points we are going to use? I repeat, 27 we have put injection, then 27, 28, 29, 30, correct? Then 31, 32, better to omit 31, leave it. You go to straight away 32, 33, 34, 35. Or you can take up to 34. Clear, brother? Savik?
Yes, yes.
Clear.
Yeah. Clear. So how to insert an injection? I'll show you.
Painkiller.
Yeah. So this is 10 ml syringe, right? But the needle of 10 ml syringe is very broad. It is painful. So what you will use? 23 number.
Yes.
This is going.
So this is a 23 number, which is accompanied by 2 ml syringe. Correct?
Yes.
Now you have to bend it. So this is the needle. You have to bend it from up to here. Clear? Bend it like this. Clear?
Yeah.
Then insert in this point. What is the level of injection you will put here? D5, 60%, and they don't speak so much. D5, how much? 60%. Normal saline? 40%. How much, brother?
40%.
D,
That's 5%.
normal saline. And D5, 60%. Clear?
Yes. You mix with sodium bicarb or not?
No, nothing required. I never use any more soda bicarb. This itself is a pH, itself changes the pH balance. Because if you use soda bicarb, the whole bottle becomes wasted by evening. Means after 12 hours or 14 hours, means you have to discard the bottle after 24 hours. Why to use it? Generally what I do, I take out it from the nozzle, right? and then I put a cap over there. So what happens? Nothing goes wrong. Am I clear? Okay. Now comes the hamstring. See, this is the way I was saying. This is called SLRT. This is called 20 degree, 15 degrees. So he'll press it against your shoulder. So you see, here you can see this person. This person. Can you see him? Souvik, can you see him?
Yes, yes.
But then the position of this person is wrong. His knee should be on the table. This is called what? Stretching. But then if you give stretching, it's very painful. Patient cannot bear it. So what you have to do, you have to face towards the patient, putting your knee on the table, and ask the patient to put first on this angle. This angle, you can see. Yeah, this is a technique. You can see first 30 degree, then 50 degree, 60 degree, 70 degree, 80 degree, right? After coming to this 80 degree on stretching, so see, here you will see like this position, brother. Can you see? Can you see? Souvik?
Yes, yes, yes.
Yeah, this is the position. You will see generally the patient is like this, right?
Yeah.
So here you will see the patient is complaining a lot of tightness in various areas of the leg, right? So wherever is the complaining tightness, give him DNS injection, 2 ml each in that location, which muscle, the area, topic over. His legs will become straight. Did you understand what I said? Brother?
Yes, yes.
What did you understand? Can you repeat?
You give the injection at the most tender point.
No, not tender point. Tightness.
Minus.
Yeah.
No,
there's
no
no tender.
specific. I see. You don't choose a specific point for injection.
No, there is no specific point here. No acupoint here. It's only the muscle. It is called cutaneous.
Okay.
Yeah, the muscles are very tight. You have to give him intramuscular. And so patient will recover in how many sittings? One sitting. Then advise the patient to go for bed rest for 21 days. But then we in our clinic, we call the patient for 15 days, 3 days a week or 2 days a week. And then we monitor the patient very carefully and we recover this type of cases who needs immediate surgery. My clinic is famous for that purpose only. By this, you can complete a very complicated procedure, which is my 5 years research. I taught you in how many days? Minutes, 5 minutes. Now who is more intelligent? You or me? I think you. You may ask your questions. Questions, please. Can you hear me?
Yes, yes.
Question, please. Yes, yes, Dr. Darwin, please take your leave. It's already too late for you to sleep. Question, please. Now, those who are feeling shy to open the clothes, please do not go for this procedure. There are many people who say opening the clothes is gay. So those who people feel that opening the cloth of anyone. You have to read. It is having a lot of properties. Saline, dextrose, saline, if used properly, they have a lot of medical properties. They recover the patients very fine. I call it SNIT, Sastry Neural Injection Therapy. It was so difficult for others to give this name. Everyone was afraid to give his name to this technique. Why? It is very risky, these people thought. I said it is no risky. I said, fine. When I started this technique 9 to 10 years back, people were very afraid of this. All the anesthetists were shouting at me at that time. They said, he will kill you and you will go to jail. And I will the one who give you witness against you. I said, okay, fine. But I never went to jail for my technique. I'm still near you, unscattered, without drop. Touch it. Thank God. SNIT. Thank you, brother. Please take rest. Thank you so much, brother. That is why I say, if your mentality is negative, how will you study? Only a person who has a positive mentality will only study.
So can I ask you a question?
Yes, madam, please tell me.
So when you taught us point number 22.04, dabai. Okay, over there we had sciatica due to hypofunction of the lung. Now, how does sciatica happen due to hypofunction of the lung? Can you explain this, please?
Yes, madam, that is also true. It is actually, see, if you go to I Ching balance method, this tongue acupuncture was was the part of I Ching acupuncture.
Okay.
So it is based on rule number 1 of I Ching, lung balances kidney.
Okay.
So if there is any lack of oxygen in the body, there is lot of spasm inside the body.
Okay. So the
And
low
because
back.
of this, there is a malfunction. Yeah, there is a malfunctioning in the kidney energy, which makes the disc produced, and that is why there is a
Low back
sciatica pain. This is
or
the
sciatica
yes.
pain. Okay. Thank you,
Yes.
sir.
Those patients who are having problems in the lungs, especially bronchitis and all, accompanied with low backache and sciatica pain. In that case, this point is a super dumper point. I call it super dumper.
Okay, so when we use the point 22.04, we can reduce that pain, the sciatica pain due to lung issue.
Madam, you have to use the combination of points.
Yeah, the
Only 20
combination
points
which you
per
told.
point.
Yeah, got
You
it.
can reduce the pain.
All right. Thank you so much, sir.
If we
More questions, please.
If we treat for lungs, can't this problem be rectified when we identify?
What is your question, Afsal?
The same question, sir. Hypofunction of lungs creates sciatica pain. If we treat only lungs, when we identify there is because of lungs there is the issue.
Say one thing. What do you mean by sciatica pain?
The pain along the leg in the nerve, sciatica nerve.
How it was created? How it was created?
From L4. From the lumbar. Basically, there is a compression in the nerve.
How the compression was created?
Due to disc prolapse.
Yes. Now you tell me, only correcting going to the lung channel using 10 balance method number 1, how can you recover this pain? When there is a nerve impingement in the local area, you are asking me to use the lung channel and use the tender point. Balance method number 1. No, yeah, SIUB. Yang treats yang. I think balance method 1. Yang treats yang. SIUB. What will happen?
Yes, it should work, sir.
It should work. What it will work? Pain subside. What is the use of that pain subside when the nerve is compressed and the pain is high? That means what? You subside the pain. Nerve impingement is still there. You only change the pain pathway, not the nerve pathway. What will happen? The patient will become paralyzed in 3 days.
Oh.
Remember, sleep disc may create paraplegia.
Okay.
And you will where will you be? Tell me, where will you go?
Jail.
Very correct. And how many years imprisonment?
That I don't know, sir.
6 years imprisonment with how much money?
No idea, sir.
I'll tell you. 20 lakh rupees, or the cost of the treatment, or the maintenance of the patient. And if you're not able to pay, additional 2 years rigorous imprisonment.
Okay.
No, these crimes are well defined. Yogeshwar, these are well defined under certain sections. It is 2 to 6 years imprisonment. It is not only for Syed Afsal, it is for any person who is doing it. So now acupuncture is a recognized medical system. And if you make a mistake in that system also, you are going to jail. That is why I say again and again, improve your knowledge, don't make a mistake. That's it. In India, the rules are very, very strict, I tell you. If the patient gives a complaint against you in the police station, even the session court against any doctor in India, forget about you, against any doctor in India, he has to go, the session court can give how much money? Punishment of 10 million Indian currency. Up to 10 million Indian currency means what? All life amount you have to pay to the patient. So government of India is very, very strict. So do not create any medical negligence in your clinic. Have proper knowledge, study properly. You put lung channel, pain gone, and the patient will start walking. After 2 days, what will happen? There is more damage, the disc is outside, it will damage the nerve more. See what this is the procedure. 1 minute I'll show you. You are there?
There will be a lot of damage.
Damage or what? Paraplegia.
Yes.
You know how? This see. Here you see. That is why I call you sometimes donkeys. You see? Can you see my cursor?
Yes, sir.
If his knees become weak, and what will happen to him?
He'll fall. There'll be a lot of pain.
No, he will fall down.
Yeah.
Weakness means what? He will fall down. And then what will happen? Paraplegia. Police complain. Where will you go?
Hey.
Finish. Topic over? That is why I say, whatever I say, be careful. Hear properly. Indian government or any government is very strict with the patient treatment. That is why I said, do your MSc course, do properly. But then you know what did they write to me? You're treating such a critical condition. You know what kind of WhatsApp I am getting here? Just I introduced an MSc course for you people. Sir is trying to make money. Sir is promoting his class. You know, after hearing all this, what did I decide? I'll only give 5% seats to you. Rest all 95% seats to outsiders. Only 10 people will get admission from here. Only 10% non-medicals.
Sir, one person has done that, and I mean, we shouldn't be getting
1%. One, you are saying one. More than 70 SMS I got.
Sir, out of 1,000 people.
Only from this group.
Oh, from
Imagine.
this.
What is my fault?
I mean, I don't know.
And
but
some people went to Professor Aziz to complain me. One thing you imagine, they went to Professor Aziz, my very good friend. They complained about him to me. That sir is trying to make money. Sir is trying to do. Imagine, I am giving you a degree with the help of the university and professors, my colleague professors, for
Yes.
8,000 to 9,000 ringgits.
Yes.
In India, you don't even get a primary school education.
Yes, that's true, sir.
In 80,000, what is the school fee today this time going in India? In a medical school?
Medical, that is too much, sir. That is, engineering itself, it is around 5-6 lakhs now. Medical is more.
Yes. And what about the primary school? Indian currency 80,000.
Yes.
Per year. And here how much did I do? I bought it to 70 to 80,000 rupees. And then other things I included. And people started blaming me so badly that what I became, I really became fed up.
Yeah, they're new to the field, I think. I mean, they don't know.
I became really, actually not only new, but then they made us so fed up. See, whole day we struggle in our clinic. We are undergoing, ourselves we are undergoing a serious depression because we have to pay the salaries. We are risking our life, we are risking our families. We are trying to be in the same house but away from our parents, from the small kids. And then we are so much afraid of even touching the, what you call, anything in the house, you imagine.
Yeah.
We are living like a self-criminal in our own house. You can understand how much pandemic we are having in our own mind. And then when we go to the hospital, we are not silent there. We see so many people. Today I saw I had to clear 2 deaths in the hospital. I'm a visiting physician, but then I was called up to see the patient and I said, oh, he's about to die. And after 20 minutes, he died. And then we said, you see how much undergoing stress. And at this moment, some of the students, I don't know what they write about us. And then you think that we should be motivated to give seats. We'll give it open, we'll declare it openly. What is our problem? We'll give it in the Facebook, we'll advertise openly. Finish. Whole world is there, not 1% or 2%.
Yes, that's
whole
true.
World.
That's true.
And do you think in India 300 students are not available?
Easily.
Huh?
Easily available, sir.
And I have to take students 300 from how many countries? 16 countries. So how much money student provides to a country?
Yeah.
Yes, yes. How much? Yes, yes. Take care, you need. Please take care of yourself. That is why I say, who will teach you people? Even if I teach for free, there is a headache. I completed my 600 kilometers journey. I was feeling so much painful and tired. I underwent so much stress. I declared 2 people death. One death certificate I signed. 3 people about to die today. One is about to die, maybe in 12 hours he will die. One died near us. And one is about to die within 10 minutes. So I declared how many deaths today? 3 deaths. How much crying, how much stress we have in our brain. And even then, when we come here to take the class, we try our level best that we don't bring that stress here. But we are also human beings. And we imagine how many wrong sentences they write. And if you don't want to join, don't join. Who invites you to join? Why are you thinking I'm after you to join the class? We have not requested any individual to join the class. We only say that those who want to join, they join. Yes, I will just request Ahmadi. And if required, I'll pay the money of Ahmadi. These are my people. Even if I have to pay their fees, I'll pay and I'll make them attend the class and I'll do it because they are my people. Fong, Ahmadi, and Roni. They're my people. It is my responsibility to make them a very good physician. But those who are negative people, please don't write to us. Don't need to write anywhere. No one is after you to take the course. And no one is willing to teach you also. We don't want negative people. You know why we are afraid of negative people, Saeed? Because we have to stay with you for more than 2.5 years.
Correct. If gelling is
Who
not
will
there,
take a headache for free?
yes.
Yeah, that is what I'm saying. Who will take a headache for free? Because you are not paying us a huge money. You are paying it to the university.
Correct.
This amount has come down only because the professors and me are teaching for free. And in such a high stress, we have to run the clinic, we have to run everything. And then free course from our side. You are paying money to whom? University.
True.
Not to MK Sastry. In Malaysia, for 8,000 ringgit, you get nothing.
Yeah.
And in Singapore, for 1,500 to 2,000 Singaporean dollar, you will get no degree in Singapore. Which degree you will get? Tell me.
Cannot even
In
go to
2000
cannot even go to kindergarten, you know. My grandson kindergarten one month is about two and a half thousand Singapore dollar.
Oh,
he's only 6 years old. 6 years old.
And now I'm trying to bring the MSc course fees to 1 year 2,500 Singaporean dollars.
It's very, very cheap. It's 1 month my grandson's kindergarten lesson.
And see, Fong, people are writing me for that purpose. That I'm trying to promote my class here. You see, if I want to promote my MSc here, will I spend 500 hours here or I'll to spend 500 hours in my marketing?
Yeah, yeah. That's very unfair, very unfair. Yeah.
Huh?
They do such things very unfair. Yeah.
Do you think I expect to take any student from this class? Fong, what is your opinion? Do you think I will take these students to my MSc class?
I cannot. I think they
Yes, you are right.
They don't know the value, you know. They don't know the value.
Actually, the question is that these people are non-medicos, right?
Yeah.
So they have never gone to hospitals, right? They do not know what is the reaction of the patient, right? Particularly, none of these people have been slapped by the attendant of the patient, I suppose. Right, Fong?
Yes, you know how much I spent for my daughter's education to become a doctor in a New Zealand university. 1 year is about 50 to 60,000 Singapore dollar times
and we are trying
6 years. 6 years. So I spent about nearly $400,000.
And now you see how much we are planning to bring it here for 2 years.
That's why it's very cheap. You know?
5,000 Singaporean dollar, less than 5,000. We are also trying to get the paper published and all these things in this price only. We are going to have regular lectures. Only one thing I did, I said that please don't come and stay in the hostel. Otherwise, your whole routine will be destroyed. The classes will be from 6 to 10 or 11 o'clock. And I tell you, this is the first type of this experiment in the world.
Sir, Indian time 6 o'clock, 6 p.m. sir?
Yes.
Okay.
6 to 7.
Okay.
So this is the first experiment in the world with 12 professors under Lincoln University, 12 to 15 professors. And some people went to the height and said, you know what, Mr. Fong, they said that after my death, who will take the class? And who will invest the money only on sir? Who will take the risk of investing money on sir? You imagine. What did I say to these people? Huh? What should I say? Did I invite them to class?
You should ignore such.
Yeah, I should ignore them. They don't know the value. They
Huh?
don't know the value. It's just
Very
buying
true. They
something.
don't
They
have
don't
any.
know.
80% people of this class, they do not know the value of medical education. They will only know. You imagine, even for my treatment, I charge how much? 4,000 ringgits. For how many hours? If you see, properly, if you see, how much time do I give to one patient? I give around, yes, Diana, you can leave. Anyone can leave. No need to worry and ask me. See, generally, I take the most riskiest case in a hotel environment when there is nothing. There is no infrastructure of treating such patients. And I treat them in the hotel environment, taking the utmost risk. If you bring me this patient in the OT room, I won't charge like this. But there I am charging a risk. And that is why I see whether the patient really wants to be treated there or not. Because these conditions, they need how much? 100,000 to 200,000 Singaporean dollar to be operated. Even in India, the cost of surgery is same. Spinal surgery. And you are trying to bring the cost to how much? 2,000, less than 2,000, 1,200 Singaporean dollar. Taking the utmost risk. And that is why I say, if you learn properly, if you do properly, your price, you can take the risk, you can charge the patients. Today you are charging 50 ringgits. If you have the knowledge, you can charge 1,000 to 2,000 ringgits. So how many patients? 3 patients is enough, 4 patients is enough. If you have a proper knowledge, how much money you can charge? In 4 patients, topic over. 5 patients, or let us say 6 patients. In 6 patients, your 1 year fees is over. But then with this degree, you are going to earn for your whole life. If you do a PhD, if you do a postdoctorate, how many years struggle? 4 years. Where do you have to go? Nowhere. In your own home you are doing. No hostel, no hampering in the day work. Everything is okay. In the evening, come in the computer, learn the classes, do your assignments, give your exams. But then, sometimes what I feel, why should we do all this for the students? But then we see, if we don't do today, what will happen, they will go to jail. Today or tomorrow, they are going to jail. What will happen? Their whole life will be spoiled. Their 7 generations will be spoiled. And that is why we took this initiative that at least let us try. So that their life becomes secured. They don't make mistakes in the clinic. For me, 2 students are enough. Fong and Ahmadi. Even these 2 are my best students. Even Roni, Fong, Ahmadi. My class is over. I have established this degree not for many people, only for few people like Roni, Ahmadi, Fong. They are my best friends. Yes, others if they come, it's okay. And even if I have to pay the fees of Mr. Fong, I'll pay it. If I need to pay the fees of Ahmadi, I'll pay it. Mr. Sastry is me. What you called? Roni. There are 2 Sastris in the class. One is Roni and one me. So I was saying, I'll pay the fees of Mr. Sastry. No, it's Mr. Roni. See, we can pay. Question is not money. Question is your own education. Question is your own desire. Question is your own mental growth. Imagine $2,500 you pay for a 1-year education, regular classes. Imagine. For 5,000 Singaporean dollar, including lot of university fees, these fees, that fees. You do not know the charges. And perhaps this is the only university which agreed in Malaysia for this charge. Otherwise, no Malaysian university agreed. And it was me who agreed. I spoke so many times to Amea Bhumik and Professor Aziz. Somehow it was agreed. And that is why I say if you don't have numbers, it will become difficult because you need to invite so many professors from different universities, colleges, and we will like to invite some professors from Australia, some from Germany, some from France. They charge for what? One lecture they charge $500. So we wish that if we have numbers, we can pay these people. For whom are we paying? For ourselves? We have enough knowledge. We can run our whole clinic for whole life. But then we want that you hear these people also. What is their experience? How they teach? It will only broaden your mind. I hope one day you will understand. Sometimes I feel that I'm happy that I have some fatal disease, that I'm going to die soon. Because some days it becomes very difficult for us to manage the stress. Especially the clinical stress when we see the people don't have money and they come to the hospital where we will treat the patient. Okay, you don't pay me 1 single rupee also, I'm ready. But how will I pay your money when I don't have money to pay your hospital bills? Earlier, what we used to do, we few doctors used to collect some money among ourselves. You give 5,000, you give something, you give something. We used to make 2,000 US Singaporean dollar and you used to pay the hospital charges. But now we all doctors are running what? No money. We don't have money to run our own families. Somehow we are running our family clinic because we cannot charge the patient nowadays. Condition is very pathetic. Poor people are there. How can I charge? I was a front runner. Then I became a clinic. Then I am working in the hospitals. I am working in 17 hospitals. My driver, I have to motivate my staff. Everyone is so fearful. I am also so fearful. If something goes wrong with these people, what will happen? But then we have to motivate ourselves. We always have to believe ourselves. Something is before us. It is service before self. We have to work for this country. We have to die for this country. This is the moment for us to die. This is how we motivate ourselves. If something goes wrong, if I by chance I get infected with COVID, there is no chances of my survival. Because it will be a comorbid condition. My lung is not functioning well. You all know that. But that is okay lah. I always believe something is above us is God. Let me do my duty. And if I will die on my duty, I'll be the happiest person. And that is why I hate my people. If by chance I die in between the courts, please refund their money and free yourself. Then these people said, no, sir, we'll complete this course in your memory. That is why Aziz established one society. So that by chance, if I die also, the course will carry on. We plan up to that level, you see. For how much money? 2,000 Singaporean dollars. That after my death, by chance if I die, what will happen? We involve those people That after my death also the courses will continue, the course will continue. Professors are there. Only I died. But then these people went and said to Aziz, you know what? Some people went and they said this and that. Aziz was saying me, brother, what did you say? I said, brother, I said nothing. I only said, you study MSc. That is why I said, who will teach these people? One Muhammad will be always be positive person. Find out a way. That is what I said. You do marketing, you bring some more students. So what we will do, we'll try to reduce your fees with that students. Your publication charges will become reduced. To publish a journal, you don't need to pay MK Sastry, you have to pay $300 to the journals. Then you have to pay to the people who will edit your language, who will correct you. Otherwise, one paper publication takes 6 years. If you go by my procedure, you'll publish your papers in 5 months.
Yeah, we are trying to, I mean, I'm trying to tell the people, sir. People have convinced, I mean, they're trying to join.
See, but the position about Indians is very difficult because they have to join 3 or 4 years course because the quality is very, you have to maintain the quality when you go to the, you have to maintain the government laws so that when you go to the court for any mistake, this degree will give you a protection for life.
Yes.
That is why I did all these classes.
Yeah.
Because if a patient dies tomorrow, court will seize your certificate. And then it will come to us only, whether you are my student or not. On that day, if I deny you, what will happen?
Yeah, my life will be pathetic.
Yes. You should know, in medical education, even after you pass out, none of the doctors, they take the opportunity to fight with their senior professors.
That's true.
Because we know how to take you out from that legal clutches. We have enough experience. We have gone enough time to the court for giving testimonial evidence for our students. This is why we are very much afraid of giving certificate, because we are afraid if we give certificate, God knows, today Singapore court, tomorrow Malaysian court. We always have to give evidence for you. Oh, yes, done this course, what I taught, what are the attendance, what is this, what is the procedure. All the lawyers will, you do not know what lawyers ask. The lawyers are horrible people of the world.
Yes.
It is like, when you speak to these lawyers, it's like in the whole court, they'll open your shorts and they'll fuck your ass. They'll fuck your ass. And what is my fault? I only give a degree to you people, a genuine degree. And for that, my ass will be fucked by the lawyer. They are questioning, their approach, everything is there to make you a criminal. That is why I say, tomorrow's medical science, tomorrow's laws in India is very strict. Even at the session court, local court, I am saying, you have to pay a compensation of $10 million. That means how much?
1 crore rupees?
Yes, 1 crore means how much? It will become to Singaporean how much?
It is 50, half, sir, half the amount. 50 lakh rupees.
No, Singaporean is 50, 1 Indian, 50 is bucks equal to 1 Indian. 50 bucks equal to 1 Singaporean dollar.
Yeah, that is 50 lakh Singapore rupees. 50,000.
No. 50, no, 100,000.
Yeah.
200,000. 200,000. Yes. Yeah. So 200,000 equal to 10 million Indian rupees. You imagine. That is why I'm teaching you that nothing goes wrong to your whole future. If this is your profession,
take it with all respect. Treat the most critical cases, but you must know what you are treating and where. See, we all know our knowledge, so we take the risk and we do it. How many people died in my hand? See, I treated more than 2 million patients. How many died? 2 million into 10 times how much? 20 million people I have treated in my life. Because one patient you treat for 10 days, so 20 million people into 10 times how much? 20 million treatments I gave. How many people died? I have completed my 30 years of medical service. I started treating patients when I was a student of what? Class 8 or 9. Since when I was a student of class 10, 9, I took my needles. In class 8, I started my needling procedures. I still remember. And that from class 8 to now, I'm practicing these critical diseases. How many years?
30 years.
Yes. When I was of 10 years, I started my practice. And today, how much? 30 years. And in this last 20 years, that we have reserved only 5% seats to 10% seats for non-medicals, out of which my at least in this, already my 100 seats are gone. More than 100 seats are finished. I have only how many seats now? 130 or 150 seats, out of which 10-20 seats are gone with my people, like Mr. Fong, Amadi. All these are my people. I still say.
Sir, the admissions have started, sir. I mean, I don't know. I mean, I don't have any.
No, admissions have not started, but my admission has started. I don't follow anything. I follow MK Sastry rules regulation. I don't care about anything. If
Please
I
consider.
want to, that is why I say I only test the people. When I asked you to pay the Zoom, I only tested your mentality. I only tested the mentality of Amadi. What is his mentality? What is the mentality of Roni? Do you think I can't pay this much money? But then I want to see how much you can, what is your mindset? Knowledge comes with mindset.
True.
If your mindset is not proper, no teacher is going to invest on you. We have so much population. You want to see? You just see after 5 months. Out of this class, I tell you only 5 or 10 people will get chance, or 20 people will get chance. Seats are finished already. Before my admission starts, more than 100 seats are already finished, and 10-20 is my people. Pong, Amadi, and what you called NG. Let NG not pay the fee. What? I'll pay the fee of NG. Ajija. This is why I say I'll see for my family, because these are the people. Yes, yes, who want to go, please go. We have no problem. I am also going after 5 minutes. But then there are two types of mindset. One mindset is what? One mindset is to study, and one mindset is to continue, so that you can recover the autistic people, you can recover the ADHD cases. Mohammad Bashir, your son is an autistic child? Bashir? Mohammad Khairul Bashir?
Can you speak to me? Anyway.
Autism, sir, you mean autism? That,
Yeah,
what has it?
I think his son is having autism. Anyway, there are a lot of things which Khairul can do, which I will teach him, so that his son will improve. If it is autism. Anyway, thank you so much. I'm only saying one thing to you. If you are not positive, no one is going to invest on you. We are not going to invest 1 minute on this. Is a free class. It has nothing to do with MSc class. Even if I start my MSc class, I'll find some time to teach this class. This is a free class. My classes are always free. MK Sastry is always free.
Yeah.
But the universities are not free.
True.
But then because of me, they have reduced your fees to how much? 95%. How much percent? 95%. They are only charging you how much? 5 to 10% of their fees. Rest, how much scholarship you are getting from the university? 90% scholarship. In my whole life, I did not get this scholarship. For getting scholarship from the university, you have to give lot of exams, interviews. And after giving interview exam, you have to take the teaching load. You have to teach in the classes. You have to take exams. You have to do lot of things to get one scholarship. Am I wrong, Mr. Fong?
You have to do a lot of things because you have to compete with so many students, you know.
Yeah, to get a scholarship, you have to do so many things. But I made the scholarship general for everyone.
That's right. That's right. It's a very generous offer.
I said, sir, please give the scholarship to all the students. You see how much fight I did with the Amia. If you ask me, Amia Bomi, Amia will only say, this is a person. I said, I'm one of the biggest beggar of the world. I always say, sir, I'm a Buddhist monk. I had the habit of begging. But when I beg it for the society, not for myself.
It's true.
What MK Sastry has to do? I have enough money, enough. I don't need to go to Malaysia and Singapore. If I practice in my Guwahati, also enough. I earn more than what I earn in Singapore. But then, I always say, in Singapore, I have Amadi, Mr. Fong. I go for my holidays there. And if I am not going there, I'll become sick. I don't go for seminar. I go for my leave. I just go to meet my friends. I just go to meet my friends, Ronnie, all these people, to refresh my mind. After every 1 month, I need to go to Malaysia to refresh myself. Yeah, it is different that my refreshment is with the patients, with education. You want to see places? I want to teach people. I enjoy teaching because knowledge is for everyone. Anyway, thank you so much. Take care.
Thank you, sir.